Hey, I'm back for the final video on this series of what I wish I had known prior to mastectomy. And today I'm going to be talking about what I wish I would have known about plastic surgery and having a plastic surgeon prior to my mastectomy. One thing I really wish I would have known going in is that there's two different kinds of plastic surgeons, roughly, and maybe more likely to be somewhat of a continuum of the type of plastic surgeon. So on one end of the continuum, you have a more medically trained and medically oriented plastic surgeon. So a plastic surgeon that is doing surgeries that are medically necessary. And most often you're going to find that kind of plastic surgeon employed by your hospital. So employed by the facility where you would actually have the surgery. And on the other end of the continuum, you have a plastic surgeon that specializes in elective surgeries. So surgeries that are not medically necessary, that are really there to make a body look more in line with the current style of body. But there are a very different kind of mindset and openness to unconventional views of the body, depending on where the surgeon is on that spectrum. I've only met 4 plastic surgeons myself, so I shouldn't say that I'm the expert on this, but I do wish I had known the difference between those two. I've met 2 surgeons, plastic surgeons, that were employed by hospitals and worked in a medical setting only, and I've met 2 that were employed by aesthetic centers, very high-end aesthetic centers, and maybe paramedical organizations, which were not medically focused and not focused only on medical surgeries. And the difference between the two was actually pretty remarkable in my experience. And I wish I had started out working with the folks that were more medically centered for my sake, because in my way of thinking and my value system, I am not interested in getting the perfect nipple, the perfect breast, not interested in reconstruction even. I definitely wouldn't ever be interested in an elective surgery apart from having cancer in my breast or potential cancer in my second breast. So that mindset of having everything look perfect and have an outcome that is most like a natural breast and have many, many surgeries involved to get to that outcome, that is not me. And so I don't have much in common with those plastic surgeons. And so without telling you my whole story and going down that rabbit hole, I'll just say that I really wish I had known that, of course, not everyone exists on the far ends of that spectrum. There are some that are more in the middle, and I've certainly met one that was more in the middle. But that I am most comfortable as a person who is trying to avoid multiple surgeries and who is really interested in more of a practical outcome than a beautiful or culturally ideal outcome. That working with medical plastic surgeons has really suited me, and I feel like I can speak their language and I'm on the same page as them a lot more often. So if I had known that, I would have worked from the very beginning with someone that was not there just doing boob jobs on the side in their usual capacity. Which, of course, I didn't know that was a thing at all until I stepped into that office and saw how posh it was and realized that I just probably did not belong there. I had a very strong feeling, just my intuition telling me that I wasn't really at home there. So I probably should have followed that, and I've learned a lot since then. You know, that was a year ago, basically, that I started down that road. But that's the first thing I wish I would have known. The second thing I wish I would have known was that you don't have to have a plastic surgeon. My first breast surgeon, not the first one I met, but the first one I chose to move forward towards surgery with, she told me that she really wanted to work with a plastic surgeon. She told me that over and over again. And basically, she never let me say no. I tried to say no to her so many times. And in hindsight, I kind of wish that I had been more firm and been able to finally say no. And she might have fired me as a patient. She might have just not been willing to do that. I don't know. But I had a horrible experience with that plastic surgeon. The outcome was nothing like what I described wanting. And if I had gone down the road of not having a plastic surgeon, I kind of wonder if I would have had a better outcome in the end, with fewer surgeries, certainly in the end. And there would have been a lot more wins in the end for me in that scenario. But for whatever reason, my first surgeon that I chose to work on me, my breast surgeon, she insisted on working with a plastic surgeon. And there were many reasons that she gave me for that. At the time, I was thinking I was only ever going to have a single mastectomy, and she was very concerned that a plastic surgeon would serve me well in making the kind of outcome that would allow a prosthetic to work best with my skin and my shape. And that was kind of her strongest argument, the one that really persuaded me in the end to go ahead and work with the plastic surgeon. However, I met another breast surgeon later on in my story who did totally give me the option of saying no to her plastic surgeon. And at that point, I had already had a botched first surgery and I really needed a plastic surgeon. But I really was struck with the kind of power of her saying that I didn't have to have one and how different that was from my first surgery and my first surgeon and that experience the first time around. So just know going into it, if you are still before your surgery now and you're looking at this video because you want to know some things ahead of time, know that you can say no and you don't have to have a plastic surgeon. And you might just want to have a shorter surgery with one surgeon, and you might want to look for a breast surgeon that's confident enough to work without a plastic surgeon. Like I said, my first one probably was not confident enough, just kind of looking at her behavior and her continual insistence on my using her plastic surgeon. But there are surgeons out there certainly that are comfortable working without a plastic surgeon. So they're optional. Something I found out very recently, and again, I'm a year into this whole process of having mastectomies. I've been planning my second mastectomy for about 9 months now, and I started planning my first one about a year ago. And I didn't know until just this month, actually, when I met with the surgeon that I'm going to be going forward with for my second mastectomy. I learned what fat grafting means. I always heard that term before and I thought, ew, I'm not doing that. That sounds like massively, carving out a chunk of fat from my waist or my hips or my butt, wherever the fat is. Not that I have that much fat to give personally, but that sounded like a violent procedure. And maybe it is a violent procedure, but it's much, much smaller than what I was picturing. When someone used the term liposuction, that sounded smaller to me, and that's the same exact thing from what I can tell, what I've learned, as fat grafting. When they say fat grafting, what they mean is liposuction, and they just carve a little tiny slit, usually in your belly button if you're going in for fat in your belly. And it's a very small incision, a very quick procedure, and I didn't realize that what they could use liposuction for was to just displace or replace fat, taking it out of one location and putting it into another pretty quickly and easily. And I don't think I will ever take that option, but it is really nice to know that if I ever want that option, it's a pretty minor surgery, it's a pretty short one, and it isn't going to require the heavy-duty anesthesia probably that a mastectomy requires, certainly. And so if I have an outcome that feels really lopsided, which I probably will, honestly, because it's just the way that my story is working out, then I can always later on, especially after I've gained some fat, because I'm almost in menopause now and certainly will have a lot more body fat as the years go by, I could potentially get liposuction and displace or replace, relocate the fat that is in my belly or my butt or my hip and put it into this side, which will be much flatter just by necessity than this side is going to end up being for my 2 mastectomies. So it's just really nice to know that I'm not like stuck at this dead end after this next mastectomy, that I probably won't be terribly symmetrical, and that I'll have the future option if I should want it, which I don't really think I will, because I think I'll get used to that asymmetry and I'll be okay with it. But just in case I'm not okay with it, there is the possibility of a very small minor surgery that takes fat out in one place and puts it into another. And your skin is pretty flexible in terms of being able to house that extra fat if you did do that procedure. It's just so nice to know that, and that it's just such a tiny little incision too. Like I said, it could be a little more violent if you were standing, looking at what they're doing, which you never will be because you're always going to be anesthetized. But if someone was witnessing the procedure, they do, they cut the hole in you, and then they kind of, have to like suck out a lot of fat kind of forcefully. So it's not a pretty or gentle procedure, I don't think. but it is something that's not too traumatic for the body, is what I'm understanding and what I'm told. So that's nice. Nice to know there's another option down the road if you need it. And kind of along the same lines is just the knowledge that whatever procedure you get, whatever you choose to do, whatever I chose to do, whether it is aesthetic flat closure or it's full reconstruction with implants, or if you had implants and then later on you took the implants out, there's now, this time in history, there's so much, at least in the US, there's so many options for redoing things later. So if you didn't like what you've done, I just found out recently that even a Goldilocks procedure where they're using your own skin and folding it up and folding it over to build a little bit of a mound, that's what I'm doing on this side on my second mastectomy. And if you do that, they can undo that. They can change that. They can rearrange that if you hate it. And certainly if you have, if you choose to get implants and then you have all this extra skin after you've taken the implant out because your body's rejecting it, you can have that skin taken down and flattened out and made a little bit more aesthetic. And so it's just nice to know, as you're making these decisions, again, they're not permanent necessarily. It's ideal to not have too many procedures and too many surgeries. But if you need to, you can have another surgery. And I actually have two friends around the same time that I'm going in for my second mastectomy. They're going in for cleaning up of their skin, pulling it tight, and making their incisions a little bit more uniform and their skin a lot more flat and tight so that they're not, kind of rubbing up against their extra flap of skin as they're moving their arms. And just to have that kind of neat feeling of flatness and tightness, just that feeling against your clothes. And there's so many reasons to take that extra skin away if you have extra skin. And at least at this point in history, in America, we have that covered by insurance. If you have insurance, that is usually, that is something that you can count on being covered, no matter how many months or years later you need it. So it can really give some peace of mind to know that those changes to your body are not necessarily permanent or irrevocable. And that's the one really nice thing about having so many plastic surgeons available to us, is they're going to be there as a part of our medical system, as a partner to our medical system, to plan for those revisions later on if we need them. So again, plastic surgery is not my favorite subject. It's always made me a little nervous. Always felt a little out of place and not quite at home in those lobbies, especially the ones that were not connected to a hospital. Right now, my two surgeons are actually in the same office, so in the same waiting room that I sit and wait for them. There's no ointments or silicone this or, videos playing about how to lift your cheeks and your chin and your elbow and whatever else. Those things that just got on my nerves and really grated on me are not present at all in my current choice of surgeon teams. So I searched a lot until I found the right team, and I think it's just really important to know ahead of time and to ask those questions when you are looking for your surgeon, for your breast surgeon, which is the first one that you look for usually. You just want to ask them, what their attitude is about using plastic surgeons, and are they adamant about using a plastic surgeon? Are they willing to not use one? If you are feeling like you might not want to go that way, you might save yourself some time by asking some of those questions ahead of time as you're first screening and interviewing that breast surgeon. Because it's usually the breast surgeon that's making the decision about how to use the plastic surgeon. They usually take the lead, at least in the very beginning. Ends up in the end that the plastic surgeon really takes a lot of the lead in terms of medication management, follow-ups, and checking on your incisions and those kinds of things. So they feel like the more major doctor in the end, in my experience. But in the beginning, it's the breast surgeon that's got a little bit more of the power in terms of like who they choose to work with the plastic surgeon. That's up to them. So it's all good stuff to know, all stuff I did not know a year ago, and I'm really grateful to know it the second time around. Please leave some comments or questions if you have any. Of course, I'll make another video if I've left huge gaping holes in this topic, and would love to just have conversations with you down in the comments if you have any questions. And then my next video will be just another follow-up video talking about what it's been like for the last 8 months to wear a prosthetic, a breast prosthetic, and some of the major hassles involved in that, and why I'm looking forward to not wearing one any longer. I'm sure I will still wear smaller prosthetics after my second mastectomy, but I think that I will wear them much less often than I'm wearing this single one now. So I just want to do one more review on how that's gone for me. So stay tuned for that video. That'll be coming out next week. And I'll see you then. Bye-bye.